Okay, so welcome to our monthly updates. So this is pharmacy contractors and their teams for May. These updates for those on the call, they also go out on YouTube, but they also go out on all major podcast platforms. So really, it's all about accessibility. So hopefully your whole team are able to access them. If that's when they're riding on the bus, if that's when they're walking to work, whatever works for them, we'll try and do it. So if there's any ideas, let us know. We've got a few topics today. So I'm going to talk about the Jubilee Rotor for the bank holidays. I'm going to talk about the review steering group, the community pharmacist consultation service, including an update to the backdoor numbers, a hypertension case finding service piece of news, something on discharge medicine service, and then something that's very Wirral specific on the contraception pilot. So the first thing on that list was the Jubilee Rotor. The Rotor is out, so just for all contractors, please make sure you know what and if you're opening. It will have come to you from NHS England to the shared mailboxes, but it's also up on our website if you need to refer to it. It's in the resources A to Z section, and it's under bank holiday and rotor information. So there's two things to do. One is to update your own profile so that your opening hours appear in the right way on the various platforms. And the other thing is, if you aren't open, if you're putting any helpful signposting information on your door, you know who you can signpost to when they're open, and have a look from that element. The next thing I wanted to update you on was the review steering group recommendations. So this is the proposals from the review steering group on the reorganisation of pharmacy representation. So this affects PS&C, this affects the LPCs, and it affects how you as contractors, how your voice is heard at various parts in the system. They're now published and they're up at pharmacy-review.org. And really, I just want to offer encouragement to go read the information, encouragement to attend the events that are on that site. You can go to any of the regional ones. They've started already. And then the Northwest Pacific one is on Monday the 16th in the evening. So you can go to any one you want. They're not restricted per region, but of course the 16th at the Northwest time will be more populated by local contractors than others. So it might well be that you have common questions and more in common with the people on the call that way. Next topic was around the community pharmacist consultation service, and specifically the referrals into that service from general practice. We're getting a more and a bit of an increase of the dropped or not responded to referrals that come through. And I think really just to encourage people, if you are having issues, you need to issue clear communication to your local practices so they don't add to those issues by putting more patients. Obviously, these dropped and not responded patients, not only is it a poor patient care element, it's poor customer service, but there are some examples where actually it then causes further issues and associated noise in the systems when the patients arrive back at the GP later in the day. So everything else will have been allocated, and these patients haven't been looked after how they've been expected to be looked after. So really the message is stay close to your referrals, make sure the whole team know how to check them and to stay on top of them. And have plans that you can enact in either an emergency, a surprising staffing situation, or if a pharmacy is in crisis, just so it's really clear and obvious what you're doing and how you're letting people know. Linked with the community pharmacies consultation service, just in case you don't know, we publish all the backdoor numbers or the urgent numbers for surgeries that we have. They're published on Farm Outcomes. And they're within the CPCS Annex C band. Right at the bottom, there's a little link you can click, which gives you all of the backdoor numbers that we're aware of in Cheshire and Merseyside. And these have been provided by the CCGs or indeed the practices themselves in some places for use for those sorts of services. They're not to be used for routine contact or prescription ordering. They are for urgent patient escalation. So where you do have someone in front of you that's been referred in that you need to hot hand over back, that's perfect for them. But please just be aware of them and make the teams aware that those exist. Bit of news around the hypertension case finding service. There's been a little bit of pushback about the levels where ABPM refers back in and the urgency it refers back into. And really just to urge to stick to the referral guidance. I think we are broadly sticking that way. It's in line with NICE recommendations. It's been nationally declared and approved, and it isn't up for any local negotiation. What we've seen is a few cases where it's it's been slightly more cautious than the way the individual approach has been. But actually, that's what NICE recommendations say to be. So actually, I think what we're doing is we're finding out areas where the quality of how we're operating the service is actually more in line with NICE and how some of the services have operated more locally. So keep up the good work. But if someone is challenging you on that, please stick to the guidance. If there's any difficulty or you're struggling or you're not quite sure where to go, get in contact with us through our support mailbox, and we can help advise and iron out any queries. Next topic was the discharge medicine service. We've had a first pass through on the data, and it's fair to say the completion is variable. So just a reminder, it is an essential service, so it's one contractors must carry out. We're just looking at some work to ascertain which pharmacies are getting referrals but not doing anything with them, and therefore breaching their contract. So we need to make them aware who's doing the referrals and completing them on farm outcomes, but then they're not claiming them properly, so therefore they're losing money and not making the claims they should. And what we'll be doing is we'll be putting that information together and contacting people where there's issues over the next few weeks. So that's something myself and Alison are doing over the next couple of weeks, and we'll be building that into our dashboard report ongoing as well. And then the last topic for today is specific for Wirral contractors. So for parts of the Wirral, we've got the oral contraception management pilot up and running. It's live. There are some instances of provision actually occurring. We are meeting with the sexual health service to see how we can increase the numbers of people directed to that. And really all I wanted to update on today was just, if you're struggling with any element of a service, our own Sarah Davies in our team is managing that implementation and can help you out. She can direct you to the right people if you need signposting, or she can help you navigate through the various training and registration hurdles, as well as the use of the form that go on. So please just use us, get in touch with us should you need us. Other than that, keep up the good work. And that's about it for my update. So let me stop recording.